Welcome. I'm happy you could join me today, or rather, I guess, happy that I can join you today for your public opinion class with Dr. Fisher. I am Dr. Laurie Baker. I'm an associate professor at the University of Florida, and I work with the Center for Public Issues Education, and I'm a faculty member within the Department of Agricultural Education and Communication. What I'm going to talk to you today about is some research that we've been working on during the COVID-19 pandemic and public opinion. So really seeking to understand the impacts of the pandemic on Americans. I'll start off by telling you a little bit about the PI Center, which I think will help you understand why we investigated these issues. The UF-IFAS Center for Public Issues Education in Agriculture and Natural Resources, or the PI Center as we call it, conducts research and educates on how people form and act on opinions regarding complex agricultural and natural resource issues. The PI Center encourages informed decision-making through research, education, and outreach. So those three pieces are part of the land grant mission, and the University of Florida is a land grant institution. And because of that, we all have divisions of whether we work on research, teaching, extension, or all three. We certainly, all of our faculty often work in all three capacities, no matter their appointment. My particular appointment is 65% research and 35% extension. So essentially the majority of my job is conducting research, and 35% of my job, the minor part of my job, is communicating that research and helping people use that research throughout the state of Florida and throughout the country. So that is essentially what we have been doing. I've been the lead researcher on the PI Center project looking at public opinion and COVID-19. So I just want to get started with a little bit about what we've done, and then I'll talk about how we approach this. At the end, when I meet with you, we can ask some questions, or you can follow up and ask me questions if you aren't able to attend the live Q&A session. So we started this almost a year ago now. In 2020, we conducted our very first public opinion research on COVID-19, and that was March 13th through the 15th. So the pandemic was just kind of getting started. Along that same line, just a few days after, we launched data collection with ag and natural resource leaders across the country, and we sampled from leadership programs across the United States, March 16th to April 21st. When you aren't paying people to take responses, it takes a little bit longer to get their opinion on these subject areas. So that lasted a little bit longer. And then we've continued with the public opinion piece, asking questions along the way. Some similar, some we've added new, depending on what's happening. But we do have some data collected from every point in time and from all of our audiences so that we can compare in the end. And hopefully we're getting toward the end. Public Opinion 2 survey we did April 23rd to May 7th. Public Opinion 3, July 23rd to August 9th. And then Public Opinion 4 was January 8th to January 21st. And we had a little bit of different focus in all of them. The first one was just a baseline for a lot of information, communication, economic concerns, how they felt like these were impacting their businesses or organizations that they were involved in, and how it was affecting their community. And then the second round was when we started asking questions about social distancing and things, because that's the first time we'd heard of that, and continued some of those things through Public Opinion 3. Public Opinion 3 also focused pretty heavily on food and food safety issues around COVID. And then Public Opinion 4, we focused pretty heavily on the vaccine and public opinion toward that piece. So a little bit about our process and how we approach this piece is really at the PI Center, we start with this issue ID. And as you can see by the graphic there, it's a little nebulous at times, but we try to make it as concrete as possible so we can then measure it. And in the instance of COVID-19, we really saw that, holy cow, this is going to be an issue that's really important to our country, to our stakeholders who work in agriculture and natural resources. They're going to need to know how they can talk to their public-facing audiences, how they can talk to their internal audiences about concerns over this topic, whether that's communication related, whether that's health related, whether that's general preparedness around these issues. So we started formulating that piece, and then we moved into data collection. And because we really wanted to know across the United States in this instance, how people were feeling and how they were responding so that we could compare differences between different areas, but also so we could get a broad landscape of this issue. We sampled using a Qualtrics opt-in panel. And so we essentially paid people through Qualtrics to take the survey. And we were able to sample that way across the demographics related to the most recent census data available, which at this point is 2010 census data. So we sampled for socioeconomic status, ethnicity, race, gender, income, and all of those types of categories to make sure our sample was as representative of the US population as we could get within this format. And then after we collect the data, we communicate those results to those who work with the public in most cases. We often see ourselves as kind of an intermediary to the general public. Sometimes the general public stumbles on our things or participates in our webinar, but for the most part, we're working with extension agents, communication directors, those involved with commodity organizations or policy organizations who then work with the public or who work with other agricultural and natural resource stakeholders. So that's a little bit about our process. And the way that we've worked through this is, we identify the issue, we identify the data collection, we collect the data, and then we have wonderful people within the PI Center who we work with to develop the public facing or the stakeholder facing materials. So in the case of this public opinion research, for every version of the survey, we've created a key findings sheet, an issue guide, research graphics that are available to share on social media, and we've done a webinar associated with that, as well as an informational video. Right now, those are all kinetic typography videos because that's new and trendy, and we often have students who are working on those pieces alongside with our professional staff to really develop a cohesive package around the research that we've done. And in many cases, the webinar is the opportunity for us to kind of translate some of that information and explain what it means for people working within the field. So with that highlighted, I'm going to show you an example data point, really just 3 items in our time today. We have a short amount of time together, but you can explore a lot of these other pieces, but just to walk through how we collected these. So communication concerns was one of the things that a year ago, essentially, we were sitting around saying, goodness, the information out there on this, it's just a little nebulous. And I wonder how confident people are about the communication that they're getting on this issue. So as we kind of talked about how we might develop that and how we might measure that, we realized that this was an important issue in society, has implications for agriculture and natural business resources and business owners, and just really communication rich. So essentially in the first round, we launched a series of communication questions, and this is really just 3 of them. I have many other data points related to communication, but to give you an example here of communications concerns, essentially ask people, sorry about that, whether they were concerned if they themselves were receiving accurate information or not, if their loved ones were receiving accurate information, and if others outside of their loved ones were not getting accurate information about COVID-19 during this time. You'll notice, you may remember back to my first graphic, I abbreviated these items. So public opinion 1 is PO1, ANR 1 is Ag and Natural Resource Leaders, public opinion 2, public opinion 3, and public opinion 4. And so you can really see across time in those early data points, we were seeing people concerned for themselves, concerned for their loved ones, but very concerned that others weren't getting accurate information. And you can kind of see that that trend continued Through public opinion 3, all of those continued to increase. Whereas public opinion 4, which you remember was at the beginning of January, middle of January in 2021, that concern started to drop off a little bit. And I have another way of displaying the data here where you can kind of see that trend a little more easily. Sorry, I'm not sure why my slides keep wanting to skip to that next one for you. But here you can see that that trend really started to trend downward in this last public opinion survey. So it was going up. The A&R leaders had more concern for others receiving accurate information and for their loved ones in those data points. But the others were trending upward until they took a downward trend in that last public opinion survey. So as we're kind of interpreting that information along the way, we've talked about making sure people knew if you had credible information, sharing information from credible sources, which is something that we advocated for our stakeholders to do along the way. So hopefully some of those messages are improving and people are feeling more comfortable as we're a year in essentially to the pandemic at this point. What happened with that data afterwards? I said we turned it into graphics. So essentially, this is a graphic from the very first survey. There are some for everyone, but I just pulled out an example here for you of how we took that data and translated it for our public facing or our stakeholders who are working with the public's data here. And so this was a pretty graphic breaking down those percentages so they could kind of all be in one place. One data point I didn't show you on my chart was that at this point in time, 67.5% were concerned that media and news outlets were also sharing inaccurate information. So that's a data point from earlier in time. We translated that data again into fact sheets and into informational videos and into webinars. And the webinar for this very first one, we really focused on what this meant for ag and natural resource organizations who were communicating about COVID-19. So that's how we broke down those pieces there. We also, in the first data point, when there was no vaccine available at all, again, almost a year ago, we asked people if they were willing to get the COVID-19 vaccine. And at that point in time, 80.3% of them said yes, that they were. But since then, there has been a lot of public information in the media, some of it accurate, some of it not so accurate, that has been spread. And so in our most recent public opinion survey in early 2021, we asked a lot of questions related to the COVID vaccine specifically. And in fact, we will present some of those next week, and I'll do a shameless plug in a minute for y'all to attend that webinar if you would like. But here's a preview of the data that we'll be showing, and this graphic isn't totally finalized, doesn't have all of our details at the bottom yet, but hot off the presses to share with you that the numbers that would get the vaccine have dropped a little. See, you'll say 80.3% here in that first round. Here I'm showing them to you a little bit differently in this graphic, but 38.4% strongly agreed that they would take it when it's available to them, and 15.3% agreed. So, and 15.3% also somewhat agreed. So those numbers are a little bit lower than when we asked earlier in the year. And so a lot of things happened within that point in time, right? There was more information, it was in front of them, but there was also a lot of kind of conspiracy theories around that. So one of the things that we can do with this data, and we're going to drill down into more specifics, but now we can offer organizations who are working with members of the public, with members of their organization, and start talking about what messaging might be effective for getting people to take the vaccine. So our goals are not just to collect the data, but to put it in the hands of the people that can really use the data. So in this survey, we also asked about barriers to getting the vaccine. Why wouldn't they get the vaccine? And we asked about incentives. What were people willing to do to get the vaccine? So that data will allow us to translate this information much easier to our stakeholders to hopefully increase adoption or acceptance of getting the COVID-19 vaccine. So I will talk a lot more about that on our webinar on March 9th. It is at 11 a.m. Eastern Standard Time, so that's 10 a.m. For those of you who are living in Texas. I assume many of you are, if not all of you are, if you're in Dr. Fisher's class. So if you would like to sign up for that webinar, we would love to have you there to hear more details about it. We would also be happy for you to view our website and look at all of the materials we have on this if you're interested in how we developed some of those questions and how we translated that information. I know I hit on some highlights on how we did that, but wasn't able to go into too many details about that process due to our time constraints here. But I will be available for you to answer questions in our live question and answer session. You may also visit our Pi Center landing page for more details on all of the surveys we've done and the webinars. Feel free to reach out to me via email as well, laurie.m.baker@ufl.edu, and connect with me in those ways to follow up. And I hope this has been informative in how we've used public opinion research in our current pandemic situation. So take care. It was nice visiting with you. Good luck to all of you.